May 2017. This is Pubnice's science blog. They like my tweet that I sent to Paramedics. Oshawa, Durham region is just getting Naloxone. They're waiting for the doctor's medical directive. This is a couple of paramedics, firemen. I think Bill means to keep the Naloxone out of those who write the medical directive. This is Dr. Morrison. She wrote the 2010 guidelines on opiate overdose. Dr. Norgan wrote the 2015, which is very confusing and misleading. So Dr. Morrison wasn't happy when I told her I was going to bring a tape recorder. She called the cops. Cops shook my hand. He says, "You're saving people's lives." Anyway, she's a nut. This is let's see, they're out down here. This is Dr. Morrison down here. Got credited with writing this protocol here. Whoa, this is all my little notes in here in this black here. Yeah, chest compressions only, yes, no breathing. Anyway, she crazy. And this is a couple of paramedics from Durham region. There's William. Leave that. His friend here saying, "Wait a second, what do you mean, Bill? Nobody should have Naloxone? Because your grandmother can overdose, take a couple extra pain pills, or child gets into parents' medication. There's 50,000 poisonings a year in this province, mostly children." So, Oshawa Fire Department carries, patient care should be the priority. In these cases, quality ventilations for any of the hundreds of causes of respiratory emergency. They're not cardiac arrests. They'll mimic drug overdose. You turn blue, you go unconscious, you die, you stop breathing, your heart don't stop until you're brain dead, lack of oxygen. Chest compressions ain't gonna do a dang thing except make sure you stay dead. So this is Corey, a fireman out there in Durham. Bag valve mask or rescue breathing for a layperson. And ventilations, and then administer Narcan if the situation calls for it, because a person could wake up with just the rescue breathing alone. And in their training, in their kits, they've also got EpiPen. Yes sir, they do. This is what you're supposed to do. Canadian Pharmacists Association. This is what Public Health Ontario is taught to thousands of people. They publish it in the newspaper. Yes sir. All this in red's my writing. Anyway, they're out and out nuts killing y'all on purpose. They knew it was wrong. This is just basic first aid knowledge. All these signs here proves your heart's beating. You need air ASAP. Every second you delay, respiratory assist. Every cell, tissue, and organ is dying. Yes sir. This is what you're supposed to do. Lungs and diaphragm can, not will.
If they're either not breathing or they're not responsive, the first thing to do is to call 911. Make sure that their airway is open. Make sure that when you're going to be giving them rescue breaths, that those breaths are actually going to be able to go through. Make sure they don't have a bunch of vomit or food in their mouth, for example. And then what you're going to do is give rescue breaths. Even if you don't have the Naloxone with you, rescue breathing can keep someone alive for a long time. You want to insert this part of the mask into their mouth, and then you want to put your mouth on this part of the mask and breathe. It's given through intramuscular injection, so that means a needle into the muscle. You would pop off the cap here. When you draw up the Naloxone, you have to make sure at the end that there's no bubbles. want to give it in the middle third of the thigh. So you take your alcohol swab the area down, and after you've done that, you can give the injection into the middle of the thigh. Give 2 to 5 minutes for the medication to take effect. If after about 5 minutes it hasn't, then you want to give another injection of the naloxone. You want to give the second dose. In that time, it's very, very important to continue rescue breathing.
Yes, do this. Anyway, read the comment box. It's all hyperlinked to medication and medical instructions. It's never changed. It's written in the Bible. It's a bloody breathing emergency. Nothing wrong with your heart. Don't do this. That's the worst thing you do, because there's over 1 million people taking the hospital with a respiratory emergency in Ontario per year. Less than 15,000 out of hospital cardiac arrests.